Hello, my name is Victoria Valenzuela. Sorry I'm doing my introduction discussion in the car because my 19-month-old will destroy the video. But anyways, I currently work at Northwest Hospital here in Amarillo. So I have worked at Northwest for about 3.5 years now. I started as a CNA on the stroke unit and then eventually, became a nurse on the stroke unit. And just the start of this year, I became the wound care nurse for the hospital. So what I kind of do at the hospital is more wound prevention. So I focus on the pressure injury prevention for our high-risk patients in the hospital. I also do the ostomies at the hospital. So that includes colostomies, ileostomies, urostomies. And so I do a lot of that. What I didn't know in my job role is I was going to have to do a lot of presentations and education. But it's been great and I have loved it. I do appreciate my time at the bedside, but I have loved being in wound care. So I initially, actually going into nursing school, wanted to be a forensic nurse, and that still kind of sits in the back of my mind. It's just not possible here in Amarillo. We don't kind of have that field. But I wanted to be a medical examiner. Didn't want to be in that much debt, so I came here to Amarillo to do the mortuary science program. But Amarillo College actually closed down the program after I'd moved over here, so I decided to go with my plan B, which was nursing. And so throughout nursing school, I had really set in my mind that I was going to be an autopsy nurse. I did know, though, that I wanted to get experience at the bedside just to have some foundational skills if I ever wanted to do anything else. But, after a while at the bedside, I decided to come to wound care, and I've loved it since. So not much about me. I have a 19-month-old. I have a boyfriend who I've been with for 3.5 years, still waiting to be proposed to. But anyways, hopefully that'll happen soon. I will keep y'all updated. But anyways, two strengths I think I have is, probably perseverance. I think being young and in the field I am in has really, shown me that you're going to have to get through a lot of not necessarily bullies, but older nurses who think, you might not have the capabilities that they have. And, sometimes it's true. I really don't have the clinical knowledge that most, experienced nurses do. So I think perseverance has been one. And I would just say another strength about me would probably be just my work ethic. I think, going into my role, I wasn't really trained. And so I have kind of, figured out my job as I went and really built a good program at Northwest for our wound care prevention and ostomy program. Not trying to toot my own horn. I just think I really have. A weakness is I'm really bad at being not understanding, but more accepting of, consistent fallouts. So just having to tell a nurse probably 10 times in a week, you need to do skin assessments. I think I'm very not understanding when it comes to that. And I know, having worked at the bedside, that you get busy, but I just don't excuse, not fallouts or failures, but just, I guess, ignorance maybe. I don't know that I really balance my personal life very well. I get maybe 6 hours of sleep most nights, trying to make sure I stay fit, stay in the gym. But other than that, I think, honestly, it's tough. It's definitely been a challenge. But I think I've mostly managed it well. Yeah, I don't really do anything for fun. I like to do arts and crafts, and I really get to do that a lot in my job role. Getting to make cool things and, cool educational posters and that kind of thing. I do work out, full-time mom, so not really too many hobbies right now. My plan for this next year, so I actually wasn't really thinking about getting my bachelor's. It was in the back of my mind. I did decide to go back to school, and it actually worked out because to be in this job role, you actually have to have your bachelor's, and that's just so that way you can get your wound care certification. So after I graduate with my bachelor's, I will go straight into working on my wound ostomy continence certification. And that's kind of my plan for the future. Personal goals, just trying to save up to afford a house. But other than that, that is kind of my plan, and I'm really excited to take this course.